Choosing an OBGYN for your pregnancy is a very important decision, so interviewing them is key. Today we'll be talking about everything you need to ask when interviewing a new OBGYN. So hit those like and subscribe buttons and stay with us. Starting your OBGYN interview should start with the basics. You need to make sure that they accept your insurance. It's also very important to know what hospital they are affiliated with, which is where you're going to deliver. Now, is that OBGYN a private OB or are they part of a group practice? If it's a group practice, who are you going to meet while you're receiving your care and who might deliver your baby? Sometimes you might be meeting with providers who don't actually deliver babies in the hospital. You also want to know how many babies the OB delivers every month. It's important to understand how busy they are. You want to know how many patient appointments will be scheduled and how much time will you be allotted for each visit. It's very important, especially when you're pregnant for the first time, that you have the time to ask the questions you have. And then you want to know what the after-hour policies are. Is the provider available by phone or email for questions, or do you need to call a nurse hotline for advice? Unfortunately, a lot of times things happen after the office is closed. It's important that your healthcare provider matches your perspective or philosophy on delivery, so you need to check out theirs. So start with asking them what their perspective is on vaginal births versus C-sections. And how do they decide which delivery method is right for a patient? Will they allow you to have a birth plan and try to accommodate your preferences? What are their views on pain meds during labor and delivery? And do they actually allow you to do stuff like have a natural childbirth or a water birth? What is their C-section rate? Do they allow for VBACs? A VBAC is a vaginal birth after cesarean section. If they do VBACs, what is their success rate? What is their opinion on episiotomy? And what is the rate? And why do they decide to do this? Episiotomies come with a variety of risks. How much experience do they have with high-risk pregnancies? And how do they even define that? There's different criteria which people might use to define a pregnancy as high risk, including being over the age of 35, having diabetes, or being obese. Is that provider comfortable working with a doula or a midwife if you decide to use one? How do they decide if you should be induced, and what methods do they use? Some examples could be Pitocin or Cytotec. I would ask you to say, how long is an induction? Some providers will allow for a 4 or 5 day induction, while others will only do 24 hours. And would they consider doing an external cephalic version, also called ECV, if your baby is breech? This is where they will attempt to turn the baby by manipulating your belly on the outside. This is a procedure that not a lot of providers will do, but can potentially prevent a C-section. Ask them what their thoughts are on delayed cord clamping. And when do they recommend interventions like forceps, vacuum delivery, or C-section? Ask the OBGYN about prenatal care and testing. For starters, do they have an ultrasound tech on site in their office? And how many ultrasounds are you typically going to receive? What are the recommended prenatal tests that they order? How does this change when you have a chronic condition like diabetes, hypertension, or obesity? And ask, what is their approach to high-risk pregnancy care? Are they going to send you to a maternal fetal medicine physician, or are they going to handle it themselves? Please remember to hit the like and subscribe button so you can get our latest content. Now we need to talk about labor and delivery care. Again, if you're with a group practice, you want to know who's going to be delivering your baby, who's covering around the time of your due date. With private practices, your OBGYN isn't always going to be available. So who do they have delivering the baby if they aren't available? When it comes to the hospital that they're affiliated with, does it have a high-level neonatal intensive care unit or 24-hour neonatology staff to take care of the baby in case of an emergency? You want to ask what types of pain relief will be available to you during labor, and is it okay with the provider if you don't want pain meds? You want to also ask, who else is allowed in your delivery room besides your partner? Are you allowed to have a doula, a midwife, friends, parents? Can you take pictures or video during your labor? And what type of assisted labor delivery techniques do they use? And how often are they going to monitor your baby during labor? You want to know, are you going to be constantly being monitored, which is continuous fetal monitoring, or will it be intermittent? And finally, one of the biggest things that you want to understand is, how does that provider handle a pregnancy beyond 40 weeks? Do they induce? Do they let you go to 41 weeks? You want to know what their process is for this. Ask the provider what types of postpartum care do they offer for both you and baby. Some providers will provide a comprehensive postpartum care plan. Others deliver you, and once you're outside of the hospital, they might see you one more time. What is their approach for follow-up, and how do they support you or provide resources? How are they going to manage complications like breech birth, cord prolapse, and nuchal cords? Find out if they're board certified by the American Board of Obstetrics and Gynecology. What experience do they have, and how many births do they attend as the primary OBGYN? And finally, do they have any other specializations, certifications, or training that you want to be aware of? After your interview, think about some things. Were you comfortable with the doctor's communication style and bedside manner with you? Did you feel rushed during your visit? Or did you feel like you had time to ask all the questions that you had? Did the OB take your concerns seriously? Did you feel heard by them? How was the office staff? Were they friendly, helpful? Did the office seem clean and organized? Is the practice convenient for you, both in location and hours? Do you and the OBGYN share similar views on pregnancy and childbirth? And was the doctor open to working with midwives or doulas if you hire one? I hope this video has helped you learn everything you need to know when interviewing an OBGYN. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family, and follow us on Facebook and Instagram for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.